And another question, can a pregnant patient who's infected with COVID-19 pass the virus to her baby?
That's a very good question, and it's been on many people's minds. So there's been an increasing number of probably small case series. So in total, maybe 40 to 50 pregnant women that have been reported to be infected with COVID-19 during pregnancy, or at least highly suspected to have COVID-19 during their pregnancy. These women have been followed very closely, and at the time of delivery, according to these reports, they were tested. So different samples were tested at birth, including amniotic fluid, mother's blood, breast milk, vaginal secretions, cord blood, and all of those tests were negative, which is very reassuring to hear. So again, it's still not robust data, but at least it's all pointing to the same finding. So at this time, there does not seem to be, or at least the expert's opinion is that there is no transmission of the virus during pregnancy. However, there is evidence that there is shedding in stool. And obviously, if you have a symptomatic mother, so a mom that is coughing, having congestion, the main mode of transmission is by droplets, so through these secretions. And therefore, if she's symptomatic, she could pass it on to her newborn child.
And I guess that would be a concern during breastfeeding as well. I think I read that basically it doesn't get transmitted by breast milk. However, if you're actively symptomatic and you may be contagious, that can be a problem with breastfeeding. What do you recommend mothers do?
So another good question. So again, just to think about how it's transmitted. So if the mom is symptomatic and she's coughing, there is definitely a concern that the baby could get infected. And so there are various recommendations at this point, again based on how it's transmitted. So if the mother is feeling well, but she might have a bit of a sore throat, a bit of a runny nose, and to wear a mask, so it acts as a barrier. Some centers are saying go ahead and continue to breastfeed, because as you say, at this point there is no evidence that it's transmitted through the breast milk. In the context that the mother is too unwell to breastfeed or wear a mask, there are some experts that suggest pumping express breast milk, and to have a asymptomatic or uninfected caregiver provide the milk to the infant.
Thanks.
Again, you want to avoid transmission of the actual droplet.
Absolutely.